This is a continuation of the Module 7 recording. So let's move to speaking about the politically active nurse. So the role of the American Nurses Association is on influencing policy to ensure high standards of nursing practice. They promote the rights of nurses in the workplace and project a positive and realistic view of nursing. They also lobby Congress and other regulatory agencies on healthcare issues affecting nursing and the public. Our ANA Code of Ethics, specifically Provision 9, speaks about the profession of nursing collectively through its professional organizations must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. So how can the nurse influence legislation? Activities to influence legislators vary from formal to informal. Lobbying may be defined as attempting to persuade a legislator or legislative aide of the merits of your viewpoint and to influence legislation. Lobbying is especially effective when there's an associated strong grassroots effort that provides additional correspondence and support on the issues. Special interest groups have become more politically savvy at influencing the creation of public policy, and more controls have emerged, as with campaign financing reforms. Professional organizations are excellent supports of lobbying opportunities, and political action committees are often sponsored by corporations and labor groups who want their message heard and promoted. So, professional organizations, as mentioned, can be a consult on policy and governmental affairs. The American Nurses Association Membership Assembly and the Board of Directors are charged with setting policy in healthcare, the workplace, patient care, and many other areas where nurses are engaged. When a hot topic arises, or there are various views and opinions about current events, the Membership Assembly and/or the Board of Directors may address these concerns by way of a position statement or resolution. So examples of these are position statements on bloodborne and airborne diseases, personnel policies and HIV in the workplace, drug testing for healthcare providers, pharmaceutical waste. There is a joint position statement on academic progression to meet the needs of the registered nurse, the healthcare consumer, and the U.S. healthcare system, to name a few. And this web link takes you to more of those. The American Association of Colleges of Nursing, AACN, is a nonpartisan organization that serves to educate and advocate for nursing education, research, and practice. So gaining skill in political efficacy can come around workplace issues, your involvement in community or civic groups, professional organizations, government interactions, and communicating with legislators. So, meeting with legislators, their aides, or their staff can influence the introduction of a bill as private citizens or as members of a professional organization. You can provide information to assist in drafting the bill and in gathering support for legislators or bill sponsors on the proposed legislation. You could provide testimony in committee or subcommittee hearings about their position on the bill. And we need to remember that these legislators need context for and more information on these bills, so being involved helps to provide support for that. You can contact legislators to support or not support legislation, both in your home district and in the Capitol. Contact either the president or governor about signing or vetoing proposed legislation. Respond to requests for comments, either written or verbal testimony, or submit a brief for consideration by the court. So in your textbook, Baruch and Gordon talk about the voice of agency, a strong and authentic voice as talking about what you do as a nurse and being more visible and vocal as individuals and members of organizations. So it speaks about being the agent for both nursing and the consumer of nursing services. So let's now move to talking about expanding your vision. So think about qualities we have talked about that illustrate effectiveness and appropriateness in our respective professional roles. So we know that nursing has moved to a cost, community, quality, evidence-based, and consumer-focused orientation. The Bridge to Quality from the on Health Professions Education talked about 5 core competencies. The need for nurses to provide patient-centered care, work in interdisciplinary teams, employ evidence-based practice, apply quality improvement, and utilize informatics. Patient outcomes are now being investigated along with nursing-sensitive indicators and factors that promote safe and effective care. We looked at the IOM report on future of nursing, and if you recall, the key messages there are that nurses should practice to the full extent of their education. Nurses should advance and achieve higher levels of education and training through an improved education system that promotes seamless academic progression, and that is from the diploma or associate degree nurse all the way up to the doctoral level. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And effective workforce planning and policy making requires better data collection and improved information infrastructure. So thus the need for nurses to be savvy in informatics. So their recommendations are to remove scope of practice barriers, expand opportunities for nurses to lead and diffuse collaborative improvement efforts, implement nurse residency programs, increase the proportion of nurses with a baccalaureate degree to 80% by 2020, double the nurses with a doctorate by 2020, ensure that nurses engage in lifelong learning and prepare and enable nurses to lead change to advance health, and to build an infrastructure for the collection and analysis of interprofessional data. So think about your professional practice environment and consider selected characteristics of work environments that support professional nursing practice as identified by the American Association of Colleges of Nursing. We'll speak about Magnus status, but they also talk about preceptorships and residencies. And it talks about with the increasing complexity of healthcare environments, there's a need to provide experience that assists students and graduates to make the transition to the work setting with more realistic expectations and maximal preparation. Differentiated practice outcomes include the opportunity for healthcare delivery organization to capitalize on the education experience provided by the various educational programs leading to the registered nurse license. So these differentiated models of practice can be supported by a clinical ladder or defined steps for advancement based on experience, additional education, specialty certification, or other indicators of professional excellence. And in the Institute of Medicine Comprehensive Report, To Err is Human, they talked about patient safety in the health system, and one important recommendation was to create improved practices at the interdisciplinary level. That interdisciplinary practice or collaboration is a joint decision-making and communication process among healthcare providers with the goal of satisfying the needs of the patient while respecting the unique abilities of each professional involved in the care. So mention the Magnet Recognition Program. And Magnet does require that the applicant healthcare organization meets specific eligibility require, and there are originally identified as 14 forces of magnetism, but was revised to 5 in 2008. So the first is transformational leadership. So here is where there is the vision, which enables others to promote an environmental change. The humanistic dimension in this approach is vital and does help to bring others along to improve the practice setting. So the leader serves as the role model, influencer, and enabler to promote change. Structural empowerment gives powers to those individuals. So you might have unit councils that support this kind of work, that there is exemplary professional practice, an environment of new knowledge, innovation, and improvement, and that there are empirical quality results. Collaboration, as mentioned, does involve actively working together And necessary precursors are individual clinical competence and mutual trust and respect among the team members. So the characteristics of collaboration include shared understanding of goals and roles, effective communication, shared decision-making, and conflict management. So think about your continued competence. It isn't restricted to state or federal regulatory bodies, but Nursing Social Policy Statement says that professional regulation includes a professional code of ethics, standards of practice, educational and specialty certification requirements, and a defined scope of practice. Legal regulation via statutory and regulatory requirements, institutional policies and procedures for safe, effective, and evidence-based practice, and self-regulation as personal accountability and demonstration of continued competence. So consider, are you in such an environment? So what are some challenges in your future? You need to be looking for a culture supportive of safe and quality patient outcomes. There needs to be appropriate staffing patterns and skill mixes. There is appropriate delegation activities in place. Unlicensed assistive personnel are trained and supervised appropriately. That there is competencies and continued knowledge development of professionals, and that there's ongoing education and skill attainment and refinement. Think about coordination of care across practice settings. What are the changes in populations and healthcare needs? Strategies to improve and eliminate health disparities, cost containment practices, evidence-based interdisciplinary practice, consumers are satisfied, and you're using information technology and quality-based indicators, and there is leadership on system change and redesign. So it's a high call for the appropriate practice environment, but consider, where does your practice setting fit here? So what do you want your future to hold? Think about your own accomplishments, your practice, your organization, where you are. What is your current title and position? Who are the colleagues that you work with? How does this balance with your personal life? What are your contributions, your strengths? Where do you need to develop, and what you want for your own plans? And I know I will see some of this in your portfolios. So think about, as you work towards your BSN, what does your future hold? What kind of plans do you have? And are you open to change? Consider the tools. You develop a philosophy of nursing statement. You're working on a resume to highlight the activities that you have, and then your portfolio. Remember those IOM core competencies that we addressed before, and think about, what are your plans for further development in each of these areas. I'm sure you know that life can be a balancing act, both professionally and personally, so do a SWOT analysis on a regular basis. What are your strengths, weaknesses, opportunities, threats? Think about these as you make your plans. As you're working on your portfolio, keep your tools together and update them periodically. It's easier to keep those materials updated if you're working on them a little bit at a time. Include copies of your continuing learning activities. I would encourage you to use the portfolio assignment that you're doing in this course and add to it as you move through the program. You'll be impressed by what you have done. Reflect on changes that have occurred and note further changes that you wish to make. Here are the references for this presentation, and I thank you for your attention.